think there's, okay, we have the roles of primary healthcare workers. The role of primary healthcare workers is health promotion, disease prevention, treatment, rehabilitation, and palliative care. Primary healthcare enables health system to support a person's health needs, from health promotion to disease prevention, treatment, rehabilitation, palliative care, and more. Primary healthcare professionals includes traditional birth attendants, village health workers and their roles, then community health extension workers, which we have a junior and senior under their roles also. Then we have community health officers under their roles. We have midwives, we have public health nurses, we have community physicians under their roles also. So we have to briefly discuss who are these people as groups and what is actually their roles in the community. And who are they? So by definition, traditional birth attendants, this refers to attendants. Let's say, okay, definition of traditional birth attendants. A traditional birth attendant is a person who assists the mother or a mother during childbirth and then initially acquire her skills by delivering babies herself or through apprenticeship to their traditional birth attendants. In a nutshell, this is informing us that traditional birth attendants is a person which is not formally trained, but either trained by traditional birth attendants or she acquired the skills over time by assisting women of childbearing, or women that are bearing children. Over time, she's doing it also, and so on and so on. So she acquired the skills during the processes, or she learned by apprenticeship from those that are already doing it. So, but the training is not formally. I mean, formally here, she did not go to school to become a birth attendant. That is the traditional birth attendants. So they are very essential people in the community because they help, they understand the liturgies of conducting deliveries, and they are performing well to do it very well, very effectively. So we have village health workers, and also they have their own roles in the villages, in the entire community. They are the most accessible primary health care providers in the community, in which they live. They are usually selected by the community and are expected to be responsive and responsible to the community under their roles. Treatment of simple illnesses at the village level and the referral of more dangerous or complicated cases to other local hospitals and the government health centers. In a nutshell, village health workers means they are people with formal training as health workers. They could be environmentalists or JHUs or senior CHU or either, some even labs technicians or pharmacy assistant or technicians. And their community identify them and they understand the common simple illnesses. They were able to diagnose them and manage them, and they have the knowledge of understanding the conditions that are critical or complicated, and they know how to refer. They have information. They are aware of secondary health facilities and their locations, and they will inform the patients and patient relations, as well as guiding them to go there with a signal of what is bothering them as a complicated cases or more delicate conditions. So these are their roles. Usually it is their communities that used to identify them and they task them with those responsibilities. Then we also have community health extension workers. We have the junior community health extension worker, we have the junior. So we refer to the junior J-CHU, and the senior one we refer to them as CHU. So their roles in the community, they are junior community health extension workers, J-CHU, and they were trained healthcare workers who play a vital role in delivering primary healthcare services to the community in rural and underserved areas. Well, the CHUs are trained to provide primary healthcare services at the community level. Those services include preventive health education, immunization, maternal and child health services, family planning, and the basic curative services. In a nutshell, junior community health extension workers are assumed to work under CHU, which is the senior community health extension workers. So the roles they play is where they are organized. The junior CHUs more of stay behind in the rural areas, while the CHU more of also stays in the organized settings of primary health care. So if any case happens maybe in the downstream of the communities, the JHU first are the most closest people to these people. And when they see and they refer them to their facilities, they are at that community level. The CHU are there to receive them. And some of the services they render is preventive health education, immunization, maternal and child health services, family planning, and the basic curative services. So what they do, most of them can manage simple cases. They were also involved in community mobilization, health talks, health education, in preventive measures to prevent diseases and to prevent spread of infection. And they are also involved in serving immunization, and also they are also involved in immunization campaigns to various communities and house-to-house immunizations of various killer diseases of the children, mostly 0 to 59 months. So they are the ones participating in that aspect. Yeah. So we also have community health officers under their roles too. The community health workers are health workers whom undergo the formal training to undertake community advocates and are often agents of social change. They advocate for underserved individuals or communities to receive services and resources to address health needs, collect data, and relay information to stakeholders to inform programs and the policies, provide informal counseling, health screening, and referrals. They build community capacity to address health issues. So we say community health officers under their roles. In a nutshell, these are the people that undergo specific trainings. We are now coming to functions and the responsibilities of the nurse in relation to other workers within the primary healthcare settings. As usual, nurses are nurses, while nurses are more of owners of the healthcare facilities everywhere. And we all know that nurses are facing some challenges in any healthcare facilities because the CHU feel they are equal to the nurses, while by certification for nurses, by the exposure of or services renders, nurses are more of superior to CHU. But the CHUs feel they are the owner of the community, while in the facility, nurses are superior to them. And medical officers, meaning the physicians, the doctors, they want to see nurses as their subordinates. Meanwhile, in focus and in view in nurses. We are not seeing them in that way. Rather, we see them like team members, as a health team. Because normally, only nurses cannot legally or legitimately manage a patient. Even if they can, by role share, they are not, it's not ideal. For example, now, a patient that needs to be diagnosed of a surgical case and to be surgery on, meaning the patient that have to undergo surgery, a nurse can equally diagnose him that you have appendix, but by role in the service, in the facility, that should be left to a physician. And if there is surgery, yes, it's a teamwork. You have a doctor with another doctor assisting him, with person in care of instruments, which we refer to as perioperative nursing, which prepare the patient before the operation and take care of instrument during the surgery. They will also have an anesthetics, which anesthetize the patient before surgery and during the surgery, take care of the patient's well-being or patient's cardinal symptoms to be well. So he controls the status of the patients during surgery. So you see, they all have a role to play. Without instrument, or without guide or control to instrument, only doctor cannot operate a patient. Likewise, a pair-up cannot sit down alone and do everything. If everyone key to his role, they have to work together. The same thing with anesthesia. Anesthesia monitors vital signs during surgery. He controls the patient's awareness during surgery. He maintains the patient to be unconscious, painless during surgery. So it's a teamwork. But it's unfortunate. The doctor do not look at it that way. Because even where there is no surgery, when the doctor prescribes, the nurses administer the medication, i.e. injectables, and so on. So there used to be all these little crises. But notwithstanding, a nurse needs to know his functions and responsibility in the primary healthcare settings. Number one, in the primary healthcare settings, a nurse is a care provider. A nurse in primary healthcare is also a care provider. The nurse also provides skills care in clinics and at doorsteps during home visits. He or she provides required care according to the needs of the patients. Yes, it's not fixed, it's not certain. This is telling you or telling us that you have a skill. You have something to regulate. You decide. You are not manipulated. So you have to use your brain, use your knowledge, use your skill, decide and act. And that is why we used to develop nursing care plan within your knowledge. Then a nurse is also a collaborator at primary healthcare level. The PHC nurse, that is primary healthcare nurse, work collaboratively with the health team members in providing health care services. Where there is a need, collide with others to provide healthcare service needs. Then the nurse is also sensitive observer. In a primary healthcare nurse is also at alert and an active observer, as she is supposed to be aware of her surrounding environment for changes and the sensitive indications of natural disaster. Yes, as usual, every human being is supposed to be such. But a nurse in care of patients in the ward or in a facility should be observant, sensitive observant indeed. Should, in case you smell burning cables from electricity that could bring disaster to the facility, you have to be aware of all those senses and be very good observant in care of your patients, and so on and so on. Then the nurse is also a concerned advisor. The primary health care nurse advises authorities and the people of the community on how to handle problematic situations concerning healthcare services. Yes, a nurse in the community, individually or in group, you help to educate, you observe, and advise. Sometimes you may see people with health issues that will resist attending facilities, or some will even have their dressing or POP. You see them at home, but not giving it care the way it's supposed to be. On observing those things, you give them expected advice on how to take care of those health management. They will also have managers. A nurse at primary health care facilities is a manager. Community health nursing organizes and manages various health plans or programs, and also does monitoring of health activities. Yes, in a community and community health facility, if a nurse is there, the nurse is compounded with primary health care knowledge. So she coordinates all reports for immunization and other information to enhance other health programs and reporting of health programs on grounds, and the managing clinics like antenatal clinics, diabetes clinic, and so many other clinics in the facility. The nurse is also in charge of regulating all those activities in the facility. A nurse by service is also a motivator. A primary healthcare nurse motivates people in the community in maintaining their health. You motivate them, behave, act, and be a role model to a positive lifestyle and motivate them to have a healthy lifestyle. Then leadership. In the absence of a medical officer, the community health nurse is the leader of the health team at the primary health care. Yes, it's already organized, which the team must have a leader at all given time. So in the presence of physician who diagnose the patient and every other member of the health team work towards that achieving cure for that diagnosis, remain the head. In absence of him, the nurse took over that responsibility. And that is leadership in the healthcare primary settings. Then education. In primary healthcare, nurses promotes the health of the community through health education. They teaches, or she or he teaches, the importance of breastfeeding, nutrition, weaning, and the family welfare services. Of course, all these are responsibilities of a nurse, educating the community, either individually or in group, organized or non-organized. Anywhere health talk can take place. But mostly organized places in the facility during antenatal care. There used to be fixed days for antenatal care. We used to have congress of women with pregnancies, and they give the relevant health talks on how to take care of themselves and their futures in their conception. Also, during maybe diabetic clinics, they give relevant health talks on how to go on their dieting and so on and so on. Also, during in the clinics of pediatric clinics, they give relevant health talks on how to prevent illnesses of the children by neatness and maybe nutritional feeding and whatever. And also, during the hypertensive clinic, they also give health talks on how to live humbly, and how to adopt a simple lifestyle without health complications. And with this, I think we shall come to the end of this class. So thank you very much. I sincerely appreciate you for a wonderful and good listening. Thank you very much. So I will say bye for now. And I think with this, we have come to the end of this topic, primary healthcare 1 and 2, for this present semester. So maybe in the subsequent classes, we will come with revisions and also attempt questions or attempt to answer anticipated or possible questions that could be raised under these topics. So thank you very much. So I will say bye for now.